Hi there, Mom and Dad. Worried ka ba dahil meron kang toddler na super likot? Ngayon nahulog si baby, tas natamaan ang ulo. Worried ka ba? Kailangan ba ng CT scan? Kailangan ko pang dalhin sa doktor? What to do? Or meron kang grade schooler na anak, tapos nagbabike ito, hindi naka-helmet, tapos nahulog na tamaan din ang ulo. When should you worry? Well, before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to help you, moms and dads, so you can raise happy and healthy kids. In today's Ask Me Anything episode, we will talk about concussion, which usually arises from head injury. Let's get started. The first question I usually get is, what is a concussion? Ano ba ang concussion? Well, ito ay klase or type ng traumatic brain injury na nadulot sa jolt or bump or blow to the head or sa ulo. Ang nangyari, inside the skull na matigas, yung brain natin pwedeng naalog. And this movement can lead to chemical changes in the brain or sometimes can damage brain cells. Yun yung concussion or a traumatic brain injury. Alright, number 2 question. What are the signs and symptoms of a concussion? So, anong signs and symptoms na may concussion ang bata? Well, merong mga physical symptoms na tinatawag. Pwedeng ang bata magkaroon ng headache or nahihilo or dizziness. Other symptoms include nausea and vomiting or yung pagsusuka. Pag older child, pwedeng mag-complain ng blurry or double vision and pwede ring sensitive sa lights and sounds. Meron din cognitive symptoms kagaya ng confused ang bata, nahihirapan mag-concentrate, or nahihirapan mag-memorize if gagawa ng schoolwork. Also, pwede ring emotional symptoms like irritable ang baby, or sad ang bata, or anxious. These can be signs and symptoms as well. And there might be sleep disturbances like mas sleepy than usual or nahirapang matulog din. So, all that I mentioned are signs and symptoms of a concussion. Alright, number 3 question. What should I do if I think my child has a concussion? So, this is an important question. Anong gagawin if you think your child has a concussion? Well, first of all, if you notice signs and symptoms and you're worried agad that the child has a concussion or traumatic brain injury, remove the child from play or remove the child from any activity immediately, kahit mild pa yung symptoms. And it's important to contact your pediatrician to have your child evaluated. It is advisable na hindi mo muna pabalikin sa sports or physical activities hanggat hindi pa nag-clear yung bata ng doctor. Alright? Fourth, and an important question I always get, does my child need imaging tests or a CT scan? Yes, I always get this question. Pag nauntog, pag may jolt, or brain injury na trauma sa head, always question, kailangan ba ng CT scan ng bata? Very good question. In most cases, the good news is children do not need CT scan in most cases of a concussion. But the doctor may request for and order a CT scan or an MRI of the brain if the doctor is worried for more serious brain injury, such as severe headache or repeated vomiting in the child, suka ng suka, and of course, an important sign and symptom is nawala ng malay or loss of consciousness. All these three might signify a serious brain injury, and at this time, the child may need a cranial CT scan. Okay, number 5 question. How long does it take for a child to recover from a concussion? So, pag nagkaroon ng brain injury ang bata from the trauma, how many days or weeks bago mag-recover? Well, the good news is most children recover from a concussion in a few weeks. However, recovery time may vary depending on gaano ka-severe ba. Pag mild lang, it can take a shorter time, or for a mere serious head injury, it might take longer. What is important is have your child rest and do a gradual return to normal activities. Again, it is best that you talk to your doctor about it. Okay, number 6 question. What is the treatment for a concussion? So, ano ang gamot pag nagkaroon ang bata ng concussion? The most important thing is to rest. Physical rest. So, avoid physical activity and mental rest as well. Encourage your child to rest. No gadgets, please. Rest is important in the first stages. And the next step in the treatment is gradual return of activities. So, before returning to schoolwork, make sure the child has no complaints of headache or has no difficulty in concentrating. And then when you go back to school, no physical activities immediately or no PE class. And then after the child has gone over it, then slowly return to PE class. We usually do a step-by-step basis of returning to physical activity under guidance from your doctor. And also, try to avoid activities that would lead to a serious second injury, especially if your child still has not fully recovered. Okay, number 7 question. Can my child go to school after a concussion? Yes, it is possible your child can return to school, but make sure adjustments may be needed. You can let the teacher know that your child has had a concussion. So, dapat alam ng teacher ang nangyari sa bata. And make some provisions. For example, habang nag-answer ang test ang bata, can let the teacher know kung pwedeng habaan ng time to answer the test. And if possible, less homework kung maaari, so the child can rest at home. And also, at home, please reduce screen time. Okay, number 8 question. What happens if my child gets a second concussion? Wow, before fully recovering from the first. So, if nagkaroon ng second concussion ang child, kahit na hindi pa nakaka-fully recover from the first concussion, this might lead to serious complications. So that is why we always advise gradual return to physical activities. Merong prolonged symptoms na matagal yung signs and symptoms ng concussion, but severe conditions like yung second injury, yung second impact syndrome, these are severe, and although it is a rare condition, which is why laging importante na magkaroon ng medical clearance muna yung bata before resuming sports and physical activities. Okay, an important question, number 9. How can I prevent concussions in my child? So, if your child is school age and engages in extreme sports or physical activities, so it is important na yung child nakasuot ng helmet. Especially in sports and activities like biking or skateboarding or football, for example, na rough ang play. Also, teach your child safe techniques in sports. And dapat may rules and may nakabantay during dangerous plays. And also, traumatic brain injury can also happen in vehicles. So make sure your child is wearing a seatbelt or, if age appropriate, naka-car seat. And then number 10 question. When should I call the doctor or go to the emergency room? Well, seek medical help immediately. Dalhin sa doctor or ER agad if your child has a traumatic brain injury that has led to loss of consciousness or nawala ng malay. If the child has continuous vomiting or suka ng suka, or the child is complaining of severe headache or sobrang nananakit ng ulo, if your child develops seizure or convulsion, and pag confused or unusual ang behavior ng bata. Hey, if you have questions, don't hesitate to type in the comment section below. And if you like this video, watch my next video where I teach you about other child health problems.